Hello everyone, welcome to our YouTube channel Logic Medico. Today's interesting topic is pre-operative surgical evaluation of cochlear implant. So what is this cochlear implant and when it is done? The cochlear implant is done for children and adults who have got a severe bilateral, means both sides, sensory neural hearing loss. It's called profound hearing loss. And they have not been benefited by using any of the instrument like hearing aids, whatever power it is or however powerful it is, and have not improved their oral communication skill by any specific speech therapy. These are the candidates whom we do cochlear implant. This is because early stimulation of the acoustic neural pathway within the CNS, that is the central nervous system, is especially important for preschool child, leading to improvement of the acoustic memory and sound discrimination. Otherwise, what happens if we delay the cochlear implant, especially in children, their brain loses the ability to recognize the auditory input or the sound input. That can result in deaf mutism actually, meaning because they are deaf, there is no problem in their larynx or the vocal cord, pharynx, soft palate, tongue, lip. There is no problem in any articulators or the speech producer, larynx. But still they will be mute. Why? Because the brain is not trained to use the speech apparatus. So therefore, in order to prevent this, we have to do the cochlear implant. But before doing this cochlear implant, we have to evaluate pre-operatively whether this patient will get benefited from that or not. Therefore, that is a necessary prerequisite for a patient undergoing cochlear. Otherwise, you do cochlear implant and the patient doesn't recover, the patient's relative will sue you. Okay, therefore, pre-operative surgical evaluation is important. So, what is a pre-operative evaluation? Let's see this here. See, pre-operatively, the patient is requiring cochlear implantation. They have to undergo a thorough medical examination to rule out any serious illness or any genetic illness or any chronic disease which may affect the outcome of the surgery. Second, physical examination of the patient so that they are physically fit for the surgery. Otherwise, if they have some dreaded cardiovascular disease, you do the surgery on the table, the patient is dying. So, to rule out that all the organs are functional and they are normal, we have to do thorough medical evaluation by investigation. Echocardiogram for the heart, spirometry for the lungs, endoscopy for the GIT. So there should be no CT scan. That also can be done, but medical evaluation has to be done. Audiological investigation is necessary, especially the tuning fork tests like Rinnes, Weber, and all the pure tone audiometry, the Bera, so that we know that the patient has got only sensory neural hearing loss, profound sensory neural hearing loss, to rule out any other condition like autism, other hearing disorder, autism spectrum illnesses, any mental illness and all. So the patient will not be able to cooperate for audiological examination. Then radiological investigation, a computerized tomography, that is a serial X-rays of the brain, that there is no brain tumor, congenital hemangioma, meningoma of the meninges. There is no other complication other than hearing. MRI is a soft tissue scan, magnetic resonance imaging, where soft tissue is clearly visible. The endolymphatic duct, the cochlear duct, the semicircular ducts, they should be clearly visible on an MRI scan. CT scan, the bony aspects will be clearly visible. They are important to evaluate the cochlea and especially the auditory nerve. Auditory nerve should be intact. If at all there is some tumor along the auditory nerve, even though we do cochlear implant, because of the tumor, it will affect the hearing. Okay, and also the psychological test. If the person is not psychologically normal, then you do all this and the person will not improve. They will not communicate in whatever way. If they have ADHD, attention deficit hyperactivity disorder, autism, they will definitely not respond. So psychological evaluation is a prerequisite before doing cochlear implant. Then speech evaluation. This is important to know what level of speech defect they have and what therapy can be given to them in post-operative care. So, and we have to enroll them in oral education program so that they use the organ of speech and articulators so that they are able to communicate after the cochlear implant when they are able to hear us clearly. In addition, regular follow-up and mapping of these implant are held more frequently, especially in children, because to know the location of the cochlear implant, if it gets displaced from the temporal bone or gets infected, we have to follow up these patients along with specialized speech therapy. Each new mapping is evaluated, and according to that, the record of the patient, a separate book has to be kept and visit has to be recorded. With regard to acoustic perception of sound, initially it will be small, subsequently slowly it will build on, it will become medium, then high. So they are able to perceive the sound more clearly when compared to before the cochlear implant. So how will you know they are perceiving better? Only if you pre-operatively document how much decibel they are able to hear before operation, and after operation how many decibel improvement is there after 3 months, after 6 months. So the follow-up becomes extremely important, and they have to maintain a book. The follow-up for the perception of sounds, follow-up for the improvement in the speech, and discrimination of the sound wave, especially the elements of phonation, whether they are able to pronounce fa, la, na. You are better positioned than me based on the various phonetics. And nowadays, recent the pre-operative vaccination procedure, especially for this bacteria, Streptococcus pneumoniae and H. influenza, Haemophilus influenza, these post-operatively the infection of this would have resulted in failure of that. We have to remove the implant because the infection has affected the implant. So nowadays, because of pre-operatively we are giving vaccines, the chances of infection with these organisms and resulting complications are reduced. The person also have to take antibiotic treatment during the implantation and after the cochlear implantation, especially in children with no serious infection. So the complications are minimized because of these steps. The post-operative complications are minimized. So in summary, the pre-operative surgical evaluation of cochlear implant is we have to decide first whether the cochlear implant is necessary for this patient. Only for profound sensorineural hearing loss will benefit with cochlear implant only will be taken into surgery. If they are able to hear by hearing aids, because the hearing aid is good enough. Why we require surgery? If they are not improving any oral communication skills, then only they are fit for cochlear implant. So pre-operatively we have to know whether the patient is suitable or not. That is the first step. Then we have to do complete medical examination, history taking, that is communication with the patient's relative to know what exactly they are exposed to, what type of region they are from, okay, and physical examination of patient that physically they are fit, and medical evaluation with all the investigations for various organs so that the organs are functional, other organs like liver, lungs, heart, all the other vital organs should be functional, because it's a comprehensive, the entire patient improvement should be there. It's not just hearing, cochlear implant and go. Audiological examinations is necessary to rule out if there is any other complications other than the problem in sensory neural hearing loss. CT scan to evaluate the bony aspects, and MRI for evaluating the cochlear ducts, the semicircular ducts, okay, utricle, saccule, all these spinal details, membranous structures, MRI, magnetic resonance imaging. And then auditory nerve, we have to see the vestibulocochlear nerve, that wire from the cochlea and the vestibule going towards the brainstem, whether it is intact or not, whether it is proper or not. MRI can give us a better image. If at all some tumors are there, we should know what is the position of the tumor and the extent of the tumor. And psychological test to know what type of psychology the patient has got and whether they will improve following the cochlear implant. Otherwise, cochlear implant is successful, patient psychologically they are depressed, autism is there, ADHD is there, they will not improve in speech whatsoever. Speech evaluation is therefore important on various stages, and we have to enroll them in oral education program. Thank you for watching and learning from